Hello, my name is Sarah Jefford, and I am a family creation lawyer practicing in Melbourne, Australia. I practice in surrogacy and donor conception across the country. Today, I'm going to talk to you about planning for a surrogacy, pregnancy, and birth, and how healthcare providers can help intended parents and surrogates through that process. During COVID, I had a lot of clients contacting me and saying that the hospital restrictions meant that the intended parents couldn't attend appointments and scans, and were even being restricted from attending the birth of their child. Now that those restrictions have eased off, hopefully that's less of a problem. But there are some fundamental things for everybody to remember when it comes to surrogacy, pregnancy, and birth care. Hospitals should remember that actually the pregnancy is generally the same as every other pregnancy. It just happens that there's some extra people in the room, and that the people giving birth, or the person giving birth, is not the person that's going to be caring for the child. Now, that's actually not that different from any other pregnancy, because when a woman gives birth, she often has a partner with her who didn't give birth and is quite capable of looking after that baby. In surrogacy, it just happens that those two people, or that one person, is not in a relationship with the surrogate. The surrogate is just like any other pregnant person, so she can access Medicare benefits or private health just the way that she would if she was having her own baby. And because she's the patient, she also has full autonomy to decide who's in the room with her and who's going to look after the baby and what's the medical treatment that she wants during the pregnancy and the birth. So if she wants to do a home birth, for example, she has the prerogative to make that decision. Ideally, she's making that decision involving the intended parents and for them to be at appointments with her to make decisions like that. But ultimately, the healthcare providers can remember that she's the patient. And if she says, I want these people to come into the birth and I want them to look after the baby after the birth, she has the right to do that. Sometimes I hear that hospitals will say, oh, we've not dealt with the surrogacy before, and they'll pull out a policy from 10, 20 years ago that will say some really strange things, like the intended parents are not to be left unsupervised with the child, and that the surrogate is not allowed to breastfeed the child. Now, neither of those things have any reality in law or even in practice. A lot of surrogates will actually breastfeed, or they might even provide milk for the baby if they're not direct feeding. I direct breastfed the baby. That was fine. I was allowed to do that. That's my prerogative to do that. But it's also a discussion between the surrogate and the intended parents. It's not a decision that hospitals can make. One of the things that healthcare providers can also remember is that beside the surrogate having autonomy, just as any other pregnant person can, to make decisions about what happens during pregnancy and birth, that baby has a right to be cared for by their family. And we have laws in place that protect the family unit. Now, it's one thing to say, yeah, but actually the surrogate's the legal parent. In practice, that surrogate doesn't want to be the parent of that child, and she generally doesn't want to be doing anything other than giving the baby a few cuddles. She wants to see the baby in the care of the intended parents. And if we think about what that newborn needs at that stage, they need to be bonding with their parents. And if that's the intended parents that the surrogate has directed should be looking after the baby, then healthcare professionals should be facilitating that happening. So if that means allowing intended parents into the birthing suite, that should be facilitated as much as possible. And also that they should be allowed to do things just in any other birth. If the surrogate wants them to cut the cord and have the first cuddle, and maybe the intended mother wants to induce lactation, that should also be supported. We can't force a surrogate to do all the parenting of a baby that she's birthed just because she's the legal parent. We can actually allow the intended parents to do those things because the surrogate directs it to be so, but also because it's the right thing for that baby to be building bonds with the intended parents. If one of those intended parents was to give birth, the hospital would be supporting them to establish breastfeeding or feeding routines, to work out how to change a nappy, to wash the baby, and talking about sleep and what the baby might need before they go home from the hospital. All of that advice and those services should be provided to the intended parents, notwithstanding the fact that neither of them gave birth. The right thing for that baby is to get all the care that they deserve, regardless of who's taking them home and regardless of who gave birth to them. Remembering that the surrogacy arrangement itself has been through a whole lot of counselling and legal advice and ethics approval. It's not really for a healthcare provider to then decide that they're going to undermine that process by saying things like the surrogate must look after the baby, or the intended parents cannot stay in the hospital to look after that baby. There are other things that you can do also in terms of establishing with the hospital that everybody is on the same page and supporting the surrogate to birth and to hand over the baby to the intended parents. One of those things is that the intended parents and surrogate can contact the hospital early on in the pregnancy perhaps, and ask to speak to the social worker or somebody who is in charge of policy and ask the hospital if they have a surrogacy policy in place. And if they do, it's a good idea to have a look at that beforehand. And if they don't, then to help the hospital write a policy. And I have some resources on my website that can help hospitals write a surrogacy policy that's up to date, remembering that fundamental rules are that the surrogate has bodily autonomy and she can decide who looks after the baby, and that the baby has rights and needs to be looked after by the intended parents if that's what the surrogate has directed. I also have a resource that I often give to my clients. It's called a Surrogacy Pregnancy and Birth Planning Guide. You can download this from my website, but I also have hard copies that I can send. If the hospital isn't too sure on how to manage who's in charge, is the surrogate going to make decisions or are the intended parents going to make decisions, we can actually do documents, perhaps called a parenting plan or even a birth plan, that help those decisions being made so that everybody's on the same page. If hospitals are not too sure, anybody's welcome to get in touch with me. There are resources on my website for intended parents and surrogates around the birth planning and around the parentage order planning, and also around managing those hospital appointments. But of course, doctors and midwives can have a look at those resources too. You are welcome to get in touch. My email is hello@sarahjefford.com. I always welcome questions and happy to help where I can.